Hey, this is Dr. Rob DNP, the Psych NP Coach, and tonight I want to demonstrate with you how I teach patients about Naltrexone and Vivitrol. It's very simple. I've had great success with these medications in treating substance use, specifically opiate use disorder and alcohol use disorder, although it has recently been released as FDA approved in a combination medication for weight loss called Contrave. So I think it has something to do with cravings in general, but we'll save that discussion for another time. But let's get into the demonstration. My hope here is that we can find more people that will agree to try the product for substance use disorder by helping you gain your confidence in understanding the product and helping you explain the product in plain English so that your patients understand it better. So here's the demonstration. Super easy. I bought a padlock with 2 keys. You need a padlock with 2 keys. One of them I painted blue and the other one I painted red. So I'm going to just walk you through, talk to you exactly what I would be talking to a patient. So did anybody ever talk to you about Naltrexone or Vivitrol for your alcohol use or your opiate use? No? Well, let me go over this for you because we do have a MAT program here, and it's a great medication. No, it's not that one that makes you sick or throw up. Matter of fact, if it works the way I expect it to, you're not going to even know you're taking it. So let me show you how this works. So you have receptors in your head. And in this case, this is an opiate receptor because what Naltrexone and Vivitrol truly is, it is an opiate blocker. So why it works for alcohol, we're not sure, but it does. I can tell you for a fact that it does. So imagine this. Our friends that like opiates, they go out and use opiates, or our friends that like alcohol, you have a drink. What happens is that chemical gets up into your brain and it floats around in the soup up there, finds that receptor. And just like a lock and key situation, that chemical is keyed to that receptor. It plugs into that receptor and it activates that receptor. Boom. And that's what causes all the positives and the negatives with those substance uses. So what we do is we come along with a chemical called naltrexone. And the naltrexone looks close enough to the actual product that it can slide itself into that keyhole, but it cannot turn it. Like putting the wrong key in the wrong lock. I'm sure you've done that from time to time with your house door or whatever. But that's exactly what it's like. So it gets in there and it cannot turn it, so it cannot activate the receptor. But this does 2 powerful things for us. So the first thing it does is because something is in that hole, it tricks the brain into thinking that it's getting what it wants, so it significantly decreases cravings. The second thing it does for us is if our friends who like opiates, if they went and used some opiates, or our friends that like alcohol decided to have a drink, then what occurs is, of course, that gets up into the brain just like it did before, but now that there's something in that keyhole, it cannot get in there. And here's a very important point. The magnetic attraction that the naltrexone or the Vivitrol has to the receptor is far superior than the natural product. So there is no way that this can knock that out of that hole, which means it just processes through your blood, metabolizes through your liver, and goes out the other side. And guess what? You never even know you used it. You don't get drunk, you don't get high. And so for me, what this does is this breaks the cycle, because particularly when we're talking about AA has a saying of one's too many and 1,000's never enough. Well, what often happens in recovery is people go home, they start feeling well, and then they say, one drink. And then what happens is they have that one drink and they start feeling it and they get a little drunk, they get a little inebriated, and that affects your judgment, right? So then you say, I think I'm going to have more. Well, with it's on board, if you do have that drink, what occurs is absolutely nothing. You don't feel it. And typically, if you don't feel it and you don't get drunk, you retain your judgment and you say to yourself, that was silly of me. I'm not going to have that second drink. Now, we're not advocating that you drink on the product. Our goal is abstinence, right? But the beauty of this medication is that the studies show that even those who continue to drink while taking this drink far less than what they did before. So you've got to weigh those benefits versus the risks and decide if this medication is right for you. Now, there is a dark side of this medication, particularly for our opiate user friends, because you can accidentally OD with taking this product if you don't believe what we're saying. And what I mean by that is, unfortunately, there's some people that don't believe us and they think that they can override the product. They think that they can override that magnetic attraction, and they keep using. They don't feel it, but eventually it gets to the point where it becomes toxic to the body. Their body can't process it, and they OD. The second dark side is the person who has been in recovery for a while. They've been using the product. Their tolerance has dropped, and they think that they can go back to using what they used before, and unfortunately, because their tolerance has dropped, they now OD. So that's two things to watch out for, particularly with use of opiates. You also need to if you're going in for any surgeries or anything like that, you're probably going to need to let your surgeon know, or you're going to have to taper off the product and then go have the surgery and then restart it. Now, here's one of the major side effects is the FDA wants to warn us about liver damage. The product has been shown to cause some liver damage. Now, what we do, we get some labs on you, we take a look at your liver, and then we get routine labs every so often to make sure that your liver's doing okay. But again, let's weigh those risks versus benefit. We know for a fact the alcohol is going to affect your liver. This is just a risk factor in affecting your alcohol. So would you want to take the chance of maybe the side effect of some liver involvement, or guaranteed liver involvement if you continue to drink, right? So there you have that. Now, the product comes in two forms. It comes in a pill, which is very economical, and you take it every day. And it comes in injectable form, which is called Vivitrol. That's only a brand name. It's a little bit more on the pricier side, but most insurances do cover it. And some programs have some grant monies that help pay for it. So the difference for me between the two products is the difference between waking up and having to string out your safety net every day by having to take that pill, or having somebody do that with that long-acting injectable that's good for 28 days, having somebody string out that safety net for you for 28 days. So the recommendation in early recovery is to trial the Vivitrol, the long-acting injectable, because you don't have to remember to take the pill. It puts it on autopilot for you. If you forget the pill and you're out and you walk down that alcohol aisle, or you're at dinner and you see somebody drinking, your defenses are down. With the Vivitrol on board, those defenses are there. That safety net is there for 28 days. Now, for the Vivitrol, the other side effect that I do need to make you aware of is in trials they did see some abscess develop at the site, but it's very rare, and in practice I've not seen that. So do you have any questions for me? No? Well, you want to try it? We can get your labs drawn today, and we could start you on the oral, make sure that you tolerate it, and then we can if you want to go move to the Vivitrol injections, it's easy. We can just give you the Vivitrol at any time. Oh, also, if you do decide to take the pill, if you forget to take the pill in the morning, just go ahead and take it later in the day. It doesn't matter what time you take it. It's more important that you have it on board than exactly what time you take it. Great. Thanks. So, did anybody guess why I chose blue and red? Comment below and let me know. So comment below if you have any questions. I hope you found it's helpful. Please click subscribe, notify. Please watch out for my classes. And if I can help you out in any way, please send me a message. Thanks. Have a good night. Bye-bye.